You just got a call from your doctor. Your blood test says Hepatitis B Surface Antigen positive. Now your mind is racing. What does that mean? Is it dangerous? Am I contagious? Will I be okay? If you've been staring at those confusing lab results or worried about a loved one, you're in the right place. This video will clear the confusion once and for all. I'll explain what HBsAg really means, how it affects your health, what steps you should take next, and how to protect yourself and others, all in plain English. So take a deep breath and let's begin. Let's start from the top. HBsAg stands for Hepatitis B Surface Antigen. It's a protein that lives on the outer surface of the hepatitis B virus, or HBV. When this antigen is found in your bloodstream, it means the virus is in your body and may be actively replicating. This is the very first marker that doctors look for to detect hepatitis B infection. But this marker alone doesn't tell the whole story. It just means you're infected. We'll explain what kind of infection, how long it's been there, and what it means for your future health. Hepatitis B is a viral infection that targets your liver, one of the most vital organs in your body. The liver filters toxins, stores nutrients, and helps with digestion, so anything that damages it can affect your whole body. Hepatitis B is caused by the HBV virus, which spreads mainly through contact with infected blood, unprotected sexual contact, shared needles or syringes, from mother to baby during childbirth. Once inside the body, the virus travels to the liver and begins making copies of itself, sometimes silently, sometimes aggressively. This can lead to inflammation of the liver, and if it goes unchecked for years, it may cause cirrhosis or even liver cancer. But don't worry, it's not all bad news. Today, we have early testing, effective treatments, and life-saving vaccines. Let's get specific. If your blood test shows HBsAg positive, it means the virus is currently inside your body. But what's really important is how long it's been there. There are two main types of infection: acute hepatitis B, a short-term infection that your immune system may fight off in 6 months or less. Many people recover completely from this. Chronic hepatitis B. If HBsAg remains positive for more than 6 months, it means the virus has stayed and your body hasn't cleared it. This can last for years or even a lifetime. Chronic hepatitis B doesn't always cause symptoms. That's why so many people don't even know they have it. Even though the infection can be silent, here are some common symptoms to be aware of: feeling tired or weak, loss of appetite, mild fever, nausea or vomiting, pain in the upper right abdomen, yellowing of the eyes or skin, that's jaundice, dark urine, light-colored stools. But again, many people have no symptoms at all, which makes screening and testing even more important. So what should you do if your HBsAg test is positive? Here's your action plan. See a doctor, specifically a liver specialist or gastroenterologist. Get further testing, including HBsAg, hepatitis B e antigen, HBV DNA viral load test, liver function tests, ALT, AST levels, ultrasound or fibroscan to check liver condition. Avoid alcohol. It stresses the liver and can make things worse. Tell close contacts to get tested and vaccinated if needed. Use barrier protection during sex and don't share personal items like razors or toothbrushes. Early management is key. The sooner you get a complete picture of your infection, the better your outcome will be. If your infection becomes chronic, don't lose hope. There's no complete cure, but there are excellent treatments to control the virus. Doctors might recommend antiviral medications like tenofovir or entecavir. These suppress the virus, reduce inflammation, and protect your liver. Regular monitoring, every 6 months to a year, depending on your condition. Lifestyle support, diet, exercise, and avoiding toxins that affect the liver. With the right treatment, you can reduce your risk of complications and lead a full, healthy life. The best way to fight hepatitis B is to never get it in the first place. And thankfully, there's a safe and effective vaccine that's over 90% effective. Who should get vaccinated?
all newborns, part of routine vaccination, healthcare workers, anyone living with an infected person, travelers to high-risk regions, people with multiple sexual partners. Also, avoid risky behaviors, practice safe sex, and don't share needles. Prevention is always easier than treatment.
So let's recap. HBsAg is the surface antigen of the hepatitis B virus. If you test positive, it means the virus is in our system. But with proper care, you can monitor it, manage it, and even live symptom-free. If you haven't been vaccinated yet, talk to your doctor today. And if you've tested positive, take action now. You're not alone, and there are resources to help you. Got questions or worried about your test results? Drop them in the comments below. We're here to help. If you found this video helpful, please like, subscribe, and share it with someone who needs this information. Thanks for watching, and take care of your liver.